Welcome to Grief is the New Normal. I'm Dr. Heather Taylor, a licensed psychologist and grief specialist, here to help change the conversation about grief and build community and connection while we all adjust to this new normal we are living in. This podcast is for you if you are grieving or if you are supporting someone in a season of grief. I'm glad you're here. Welcome, everyone. I am excited for today's guest and the conversation that we're going to get to have. Joining us, we have Lauren Hunter. She's an LCSW and PMHC out of New York. Lauren, welcome. Thank you so much for being here.
Thank you so much for having me, Heather.
So do you mind sharing a little bit about you, the work that you're doing, and also what led you to doing work around birth trauma?
Yeah, absolutely. So like you said, I'm an LCSW. I'm a social worker in New York State. I have my own private practice called North Star Wellness and Therapy, located on Long Island, but I do a lot of virtual therapy too. Primarily, the clients that I see in my practice are women who are trying to conceive, are dealing with fertility challenges, pregnant women, and also women in that postpartum phase. I specialize in NICU families and working with survivors of birth trauma.
Amazing. And do you feel comfortable sharing what led you to this work? Because that's such a special type of loss and support that you provide.
Thank you so much for your compassion, even talking about this. I feel like I should say the therapist in me too, for anyone who is listening, that I can't imagine a more activating or emotional conversation. And I'm mindful that maybe people who are clicking on the birth trauma podcast to listen to might have experienced it themselves. So just that reminder to take really excellent care of yourself. For me, it's deeply personal. The NICU has always been a very special, meaningful place for my family. We lost my brother Sean in the NICU 33 years ago. And so my brother's twin survived, but my parents had to go through that, and particularly my mom as well, that birth trauma experience herself. And it was just talked about growing up too. For a silly example, a social worker had given my mom a guardian angel pin, this beautiful gold little pin. Probably didn't think very much of it. We have that pin. It's my most valued possession. I would bring it with me in elementary school, taking the standardized test.
A little charm like that. Like, I got that extra support with me.
John's got me, and he's going to get me through my ELS. So I think it was just always a very special, meaningful connection for my family. And then when I was trying to decide what the heck do I do with my life when I was in college, what would be a meaningful way to spend my days? Social work was really at the forefront of my mind since it had been so meaningful for my own family. Little did I know when I had my daughter, would have a NICU stay and a very unplanned delivery as well. So I have the personal experience and then also the professional experience of having these certifications prior to my own experience. So I do feel blessed that I care enough to go there with some of these clients because of my own lived experience. I think it does provide a different level of support.
It's a different context. It's like we speak a different language having that grief experience or specific unique grief experiences. Mm-hmm. And so being able to blend that personal and the professional, I do think it holds a different weight in that therapy space. And oh my gosh, how amazing that you grew up in a family where you talked about that loss. I think that's so honoring to you, to Sean, and way to go, Mom, for not being afraid to talk about grief within your family versus this thing that happened and we don't talk about it, which can be such a common narrative in so many families.
Yes. Thank you so much for saying that and acknowledging my mother's beauty and strength. He's sprinkled over the ocean. And so we just grew up going to every day in the summer. It was like we would go to Robert Moses Field 5 and we'd stay there for the entire day. And not knowing how incredible that was as a kid, now as an adult, looking back, I'm going, how intentional my mom was and how seamless the grief and honoring Sean and Ryan for that matter and their family's experience was in like a connection and celebratory way. You, Heather.
I love that.
Thank you.
With your work around birth trauma, can you share a little bit about what that definition is? Because it can look different for every person. And maybe what are some of those common grief experiences in your work with NICU moms?
Yes. Oh my goodness. I feel like it's so complicated. So to try and make a complicated thing a little bit more direct or a little simpler, I think my experience with birth trauma is if somebody is letting you know that their delivery felt traumatic to them, that's birth trauma.
Yeah.
So sure, we could do our measures and we could say, okay, you meet criteria for birth trauma, but to be a really client-centered clinician, I try and just listen. And if they're telling me about this traumatic experience, typically the grief, the ways that it shows up for my clients is if the birth was so unexpected and did not go in a way either that the doctors had thought or the midwives had thought that it would go, or if it went in a way that the clients didn't want it to. We all talk so much about birth plans, right? Which on the one hand can be great to consider and manage some anxiety, but then, oh my gosh, what happens when things don't go according to your birth plan and the grief that creates? So really just grieving the birth experience. I feel this so deeply. The rhetoric too around for women, right? The socialization of this is the most natural thing, like your body will take over. So for me personally, hold on, did my body fail me? Because I had a placental abruption. And if my baby's in distress, is this my fault? And as a parent, it's my job to take care of her, but I can't, she's not even out yet. How do I? So grieving, not having control over the birth experience. And especially if this is an unplanned C-section, a hemorrhage, an abruption, like very scary physical, medical things that women can experience. But the list goes on and on. So I know I'm rambling here, but I think it's just that people have such a different experience, but some of those are more of the common grief experiences that I've heard.
That the language that you shared, it's natural, your body will know. I also work in that fertility space, and there can be this pre-grief even while pregnant when you're trying to read books to be prepared for the labor experience, and that rhetoric is, well, trust your body. I needed medical intervention to help me conceive.
Absolutely.
And so I don't trust my body to then carry me through that, or I feel shame because I don't trust my body. And oh my gosh, am I going to be able to navigate that labor and delivery experience if what all these books are telling me isn't actually my experience of trust with my body? And so how do we as clinicians provide space to do that reparative work in relearning how to trust our bodies? And even like what you were saying, you had a placental abruption, and okay, so did I fail? Is that, I think there's so much nuance and unhelpful language in how we describe this potentially quite ambiguous experience that, especially if it's your first time, we don't have context for that. And so we're relying on others or research or readings to give us context so we can feel that control, when really it's dangerous. It is scary. It is very unpredictable to go through pregnancy and delivery.
Thank you for using that word too, dangerous. I feel like that's just so validating of how important trauma-informed care is. And if we have time, I have to share internal trauma-informed directory. So I see people in New York, so people could reach out to me if they're struggling in New York. But if you don't reside in New York and you're living in a different state, this directory that these amazing therapists, Olivia and Liz, formed, they've got therapists, trauma-informed therapists, psychiatric nurse practitioners, midwives, all part of it. So people can look for a trauma-informed provider, because there's a lot of work to be done. And what we're trying to dedicate our time to take really excellent care of women.
Yeah. Even when you're looking at statistics, Black women have a 3 times higher mortality rate when they're in labor and delivery scenarios. And it's like, we forget that there's a lot of risk inherent in going through pregnancy. Like, it is not just this natural thing. Bodies are complicated, and not everyone has the right language to describe what they're experiencing, and providers are doing the best they can, or they're just not informed enough to know to be looking for. And yeah, it's such a systemic complication.
Absolutely. My old coworker friend now, who's also a PMHC, Caitlin Silverstein, and I are doing this cool training with our local OBs and providers in the Northeast. I think it's a tri-state area kind of thing, New York, New Jersey. And that's what we're trying to do. Like these incredible, wonderful OBs and midwives, like we're doing kind of warning signs to look out for with birth trauma and use this screener. Please don't just give them at the 6-week, the depression screen.
Right.
I'm laughing about it, but it is enough funny.
And I don't think I've shared this on the show yet, so I'm going to share it with you. I actually had a pretty significant birth trauma. So at 11 weeks postpartum, I went into heart failure. I was diagnosed with postpartum cardiomyopathy, and I'm still in heart failure. I'm just stable now. So I was in the hospital, and my ejection fraction on my heart was down to 10%. Postpartum cardiomyopathy can happen 1 month pre-delivery to up to 5 months postpartum, and it happens to 1 in 4,000 women, and it's just not talked about. And I had no idea that what I thought was anxiety was me actually, like, I was dying. I was in heart failure at 11 weeks postpartum, and I didn't know you could go into heart failure from being pregnant.
Totally sorry that you had that experience. And I can't even imagine how terrible. So you have this little life that you're responsible for. I don't know if this was your first or your second, maybe. So 2 little lives that you're taking care of, and your life is literally at risk.
Yeah.
Oh my God. Did you feel, you don't have to answer this if you don't feel comfortable at all. Did you feel supported during that time, or was this a time that we've had to process and grieve and make sense of?
Both. I think it's a both and. I am grateful for my partner and the support he provided. Like, I wasn't feeling great at 10 weeks, went to the emergency room. They sent me home with morphine. And said I probably just needed to sleep. The chest pains were still there the next day. So we had the ambulance come to our house, and my EKGs were not showing abnormal. And so that following week, I ended up seeing an internal medicine person. And thankfully, she had seen this before in 2 other patients and was like, I don't want to freak you out, but your EKG is showing abnormalities. You need to go get an echo because you might be in heart failure. And I'm like, yeah, what? Didn't know that could be a thing. And when I got the echo, they were like, hey, you should not leave the hospital. Like, you need to go down to the ER and get admitted. Like, you don't have 2 to 4 weeks to wait, because this is also 2021. We still, like, my family couldn't come see me in the hospital because of COVID parameters, like all of that. So I was alone. My partner was waiting in the parking lot while I was getting the echo. I had to get admitted, and then I was there for multiple days until they could get me stabilized. It's been a whole process, and I'm very thankful for the area I live in. I live right next to UW Hospital. They have an amazing cardiology department. They've helped me achieve stability. I'm still in heart failure, but I'm in a much healthier space. Yeah.
Terrifying. And thank you so much for sharing that.
Yeah.
Me, like, I feel like that's where the healing can happen too. If you feel safe enough in a place that you can talk about it, like, it just matters so deeply, your story, and you have this amazing platform, and I can't even fathom. Thank God you were able to listen to your intuition too and your gut and advocate for yourself. But I will also say, as like an advocate, it's like we shouldn't necessarily need to have to advocate that much. There should be those checks in place to make sure that women postpartum are taken care of.
And so that's what kicks me is we would have been able to tell if we'd been able to do a BNP test and test the blood protein levels, which insurance does not cover because it's not standard care.
Oh my gosh.
And you can test this in the 9th month to know if the levels are up, but insurance doesn't cover it unless there's a history of heart things. And I didn't know. I had no idea because this was my second time.
Let's get in the car. We're going to lobby in DC. Let's go. Right? 5. Oh my God, Heather.
Because it can show up to 5 months postpartum. Thank you for making space. I didn't know I was going to share that today.
It's like truly my privilege.
Yeah.
Thank you for making space for everybody else.
Okay. I'm going to circle back.
All right. We're circling back.
Circling back. Okay. Back on the NICU parents thread, there's this duality of hope and grief, right? Like it's a complicated emotional experience being in that space. So how do you help parents navigate that with working on being present and making space for the myriad of emotions that come up there?
My experience was really like hope was the only thing. Hope and love was the only thing that can get people through. The emotions that I experienced, anguish, despair. And I know that sounds so dramatic, but that is how I felt as a parent in the NICU, not being able to protect or take care of my daughter and relying on other people, angels on this earth, but strangers to do for me. And so I think the NICU is a place that's full of hope, right? Can you imagine what the scenario would be if we didn't have these incredible establishments? And I also will acknowledge the privilege as well that we're in a level 3 in Stony Brook in New York, their NICU, an incredible NICU with incredible doctors. So there was a lot of hope that she would be okay. But after some scary news, like when parents do get those difficult news and updates, if you will, the parents' emotions fluctuate literally hourly sometimes in the NICU. And so if you don't have the hope to hold on to, it could be a really dangerous emotional place if they don't have a support system. I find that it is hard to hold on to hope if your baby is critically ill in the NICU. It can be really hard to hold on to hope. So that's where a lot of the deep meaning and work comes in with therapy. If we start to do like a trauma narrative and finding out, like processing is number 1 too, because it's such a shocking experience. I feel like for me and for a lot of my clients, we have to go through trauma narratives like multiple times to piece together what even happened and what, because you're in such survival mode. I don't know if you could relate to this with your experience.
Absolutely. Yeah.
But I will say to your question, my mom had this amazing friend. She's passed on since, Ruth Minsky Sender. She's a Holocaust survivor. The fact that we knew her was such a blessing. She had this phrase, where there is life, there is hope. She was an author. She wrote amazing books on the Holocaust lady and the cage. I don't know if you've read her books, but she had that phrase, where there's life, there's hope. And I actually learned that in palliative care, even people who are dying are still living. And so I think most people are pretty resilient and we're wired to look for that hope. And that's a godsend, truly.
Just writing down where there's life, there's hope. That's just, I think, such a beautiful reminder that, like, especially when you're in the NICU, I would imagine that's active grief happening.
Oh, yes.
With that active grief, how am I going to hold space to oscillate between the life-giving work and the grief work that I'm experiencing? But it's like in real time that's happening. This is in the after. I think that's such a great reminder. Yeah.
Thank you. Yeah. And just, I guess, acknowledging that there's no other way but to go like right through it. And you feel both of that. Both is like silly. It's 25 things that you're feeling at the same time, but like all of the positive and the negative emotion at the same time. And just sometimes giving people that permission if they're coming into my office or if it's a NICU support group for parents or whatever.
Yeah, because again, it's that whole you can't tame it till you name it thing. So we need to name all of the both and the hard things.
Absolutely.
Yeah. So then with NICU parents have often unique grief challenges like delayed bonding or medical complications. In your experience, what are some of those common challenges that they share and how do you support them through that?
Gosh, everyone's story is so different, and I hate to even say this, but I hope that this is validating for anyone who's listening. One of the biggest experiences that I've witnessed is inappropriate feelings of guilt that these parents have to experience. Like you're trying to understand what's going on. And so if we're feeling guilty, it can affect the interaction that you have with your angel, right? Like, of course it would. And so really just validating and normalizing the heck out of that. Like, of course we would be feeling this way, but is that factual? Like, it's totally valid, but that is not factual at all. And unless you told me, a doctor told you this, like, why are we torturing ourselves and being cruel? Let's just focus on what's in our control. What can we do? Like, the remedy for this, I would say truly is getting in there. The nurses were laughing their butts off at me. Like, we're changing that diaper, mom. We're getting right in there and we're changing. This is your angel and you are the best mama and you are the best papa for this little one. So let's get in. The nurses are amazing and they're angels on earth and they're incredible, but let's get you involved in taking care of your baby. Literally, the complication for women, if you wanted to breastfeed, but you have a preemie who also needs formula to put on the weight, right? Absolutely. Or let's say they were so premature that the milk supply like hasn't fully come in yet. And the shame, I could go on for, I don't even know how long this podcast is, about the rhetoric around breastfeeding that's so dangerous and problematic for women and families. And I think especially in the NICU, it's everything just has an additional layer of complication, including feeding. So I see a lot of that as well with some of the parents who are coming in. Did I answer that question, Heather? Did I just ramble the heck?
You gave some really good concrete examples of common challenges. So yes, you did answer the question. And like, how do we support them in that moment? We validate it. We validate that this is hard, that there's grief, that this isn't how we thought it was going to go, that maybe our bodies didn't respond how we thought they were, how my baby entered this world isn't the ideal, like what I had imagined. So you did answer the question. Like, yes.
And just survival mode too, though, right? Because it depends on how long your NICU stay is, right? I feel like some babies are there for a day to run some tests and you're okay and you can go home. Sometimes it's weeks, sometimes it's months. Like my brothers were there. Ryan and Sean were born at 24 weeks.
Oh,
so
wow.
They were there for what, 3 months? Something like that until they were okay to go. I don't know that much processing is going on at all in the NICU because you are in such like survival mode. So it's after the fact when we know things are safe and okay. And this isn't to say that all babies come home from the NICU either. So the varying types of processing and grief, it looks totally different how you would support a family. But I will say, like a concrete example, we get them into support groups because they deserve to talk to people who get it and who have been through the same thing. We do not grieve well alone. Gosh, no. So I know a lot of your clients probably too, but like these lost mom support groups, NICU support groups, fertility support groups.
Yeah, it helps to validate again with others who have that same language. They understand that lived experience. And then you mentioned in thinking about a 5.5-month stay, the physicality of bracing for impact and then pairing that with the physicality of grief, because we often don't talk about how much grief can impact us from a physical standpoint, the muscle aches, the headaches, the stomach aches, the exhaustion, all of that. And so you're right. Like when you're in it, you're so in it, you're present, you're engaged. It's hard to process while we're engaged and bracing for impact. And then it's like that tidal wave of feeling we've been holding off. It just whoosh, and you don't know when or how it's going to show up and hit. And it might take you out. And especially when you already are feeling guilty that like you were in that situation. And then now it's, oh, and now I'm getting taken out from a different layer of emotion. How do I have compassion for myself in that space?
That was so beautifully put. It's the same thing, right? Just clobbered by a grief wave, tidal wave, a washing machine wave. We can laugh and cry at the same time about tough things.
Yes. It's again, it's the duality of yes, we can do this grief work. Yes, we're clinicians and we are also humans who feel and think and have our own lived experiences that influence the type of work that we do and how we're able to approach it. So then I would imagine there's a lot of stigma around birth trauma and parents can feel isolated or silenced in their grief after a traumatic birth. How do you help normalize that and break down the stigma surrounding that?
Yeah. This question reminds me of the term like secondary losses too, right?
Yeah.
Because it's like you've been through so much and grief can be so lonely and isolating to begin with. And we're trying to process like, this is not how I thought my delivery would go. And people are so well meaning, right? Like they're so well meaning. They don't want to make you feel sad than you already are. Maybe they think, okay, what would I want in this scenario? So maybe they try and distract you when I don't know if you would agree with this, if you're clients and you feel the same way. Most people are already thinking about their experience and their loved one anyway. So let's say their name, let's talk about it. Let's give the griever the opportunity to shut it down and put them in the driver's seat of like their own
Yes.
grief. So, yeah, the stigma, especially with birth trauma, of if you are fortunate enough to take your baby home from the hospital and your baby lived, you should only be grateful. Like that kind of thinking or that kind of statement. And I appreciate that you hold space for both because it's like, of course, like nothing was more important to me. And I'm so deeply grateful. And that will still go down in history as the best day of my life because I got to meet my daughter. And I feel it was really unfair how she came into the world, right? And so many of the parents and the moms say the same thing. So, in terms of breaking the stigma, I'd say having conversations openly with safe people. So, figuring out who your emotionally safe people are and then talking about it. Or I would say to those who love someone who went through birth trauma or those who like love someone who's going through grief, look out for those resources because even though they're few and far between, they're there. And so if you're really not feeling like you're able to support, but you're willing and open to, there are resources. And I think that would go such a long way in breaking the stigma. And also, similarly to what we had spoken about in the early conversation about providers, like the continued psychoeducation for providers who are so well meaning and doing the best that they can. But we all know some providers are better than others. Some have wonderful bedside manner and some are contributing to the trauma.
Yes.
And that feels icky to say out loud, but it's so many people's experience. So we'll put it out there and name it.
Yeah. In that same vein, working with clients on the other side, and we have to do some work around building trust because we're considered providers. And am I going to minimize what was happening to them? Am I comfortable enough to sit in that hard duality of emotions space with them without running away, with avoiding talking about it? There's so many times, even with some of the postpartum moms I work with, they feel like they were in a fog that whole first year and like all the guilt and the complicated feelings there. And everyone's first year is a blur. And it's how do we make ourselves safe and not shying away from sitting in that ick in the hard with our clients and helping with that, normalizing, validating, helping them, modeling compassion so that they feel like they can do that for themselves. And then if they decide to move forward with trying to have another tiny human, okay, what's our care plan in advance? What do we want to do different, knowing what we know now, what we lived through, and be intentional with the people we invite into that space with us. Because as terrible as it is to say, it's like we remember who said the shitty things.
Oh yes.
Yeah.
Oh, yes. And like your grief, it might fade a little bit, but we remember it for sure.
Do. And even if it's well meaning, like it's still, we already feel vulnerable being in that pregnancy, postpartum space. I want to have people around me that are okay with that, with my vulnerability, with my like, okay, you might check in. I love how you said that. Like, I'm gonna not be afraid to ask and check in on how are you? Have you been reflecting on your NICU experience? And then it's on them to say, actually, I don't have capacity to talk about that right now. Thank you for asking, but I don't want to go there. Okay, great. Because then I at least invited the difficult conversation or the uncomfortable emotions where they don't have to apologize or feel any type of way.
Yeah, it's such good trauma informed care when someone has absolutely no control. you give them back some control
Oh,
in the
yeah.
healing process. And that's like a great place to start. Absolutely.
Yeah. You work very closely with moms in your private practice. How do you see the power of sharing stories, helping them with processing grief and finding connection?
It's probably number one if I had to look for one really huge, meaningful thing and somebody is processing and healing. I think knowing for moms that they're not alone. And
Yeah.
oh my gosh, here's this group of women who have gone through, if not the exact same scenario, a similar scenario. This is what worked for them. And they allow me to talk about it and they get it. And they have these resources that I didn't even know exist. And oh my God, this woman started this foundation for her baby. And oh my God, they drop off hospital gifts every holiday for the NICU. So there's such like deeply meaningful healing that happens. And I think the connection in those groups. And also, I know this sounds dramatic to say, but it's like you don't know if you're going to be okay
Right.
after the loss. And so to look to somebody else who's maybe, let's say, 3 years out of their birth trauma or losing their angel, you might be okay looking at somebody else. And I think it goes back to that idea of hope and resiliency that everybody deserves. So that's probably the number one healer that I've seen are connecting these women with support groups and people who understand.
Amazing. Yeah, and speaking that same language. Like, even if we didn't have this exact same NICU experience, we both were in the NICU or had birth trauma complications that we didn't get to go home right away or whatever that is. And someone else knows a variation of that lived experience. And so I don't have to explain the unspoken things because it's just that shared, it's that bridge. Yeah.
Yeah. And sometimes even unspoken, right? I can't tell you how many, oh my gosh, let's meet for coffee. You had this, you had, it's such a community that I didn't even know existed until I unwillingly became a member of the club. But so happy that it exists. And there is some post traumatic growth to be had in those scenarios.
Oh my gosh, yes. I love the concept of post-traumatic growth, and I use that often with clients. And this is why there's profanity on this podcast. I use the phrase like when you are grieving in that post-traumatic growth space, you have limited bullshit tolerance. And so it's like the superficiality of things, or it lands differently and you just don't seem to have the tolerance for it because you're in a growth phase and you're doing really deep, meaningful work. And so getting upset about something that like non-issue, you don't have the tolerance for that. And if
Yeah.
that's all people want to talk about, like, you're not going to insert yourself into those group dynamics, those conversations.
100%. What is that phrase? Because you just, that's so relatable. I felt that way because I always would say grief gives you such instant perspective and relationships and things that, like, okay, that's all I need to know about that person. Not to say it's black or white,
No.
but the clarity that provides, I think that definitely is part of the post traumatic growth. That can be a gift.
Yeah. So for NICU moms, sometimes the stress of caregiving often leads to burnout and or self-neglect. What self-compassion practices do you encourage for moms on that, or even just families on navigating that?
This is such an important question too, because I feel like with no birth trauma, with no grief, this is like such a difficult thing for postpartum women to begin with. So we start with basic needs. And it's sad that we're talking about self care with taking a shower and getting 5 hours of sleep that we can piece together, or making sure we're eating some nourishing meals or having somebody. If we're in survival mode, which most women are when they come home after a stay in the hospital with birth trauma, it's really just like nourishing yourself through and surviving. And if we took a shower today, like amazing. If we got a nap in, amazing. When you survive birth trauma, you're hyper vigilant because, you know, the anxiety of, oh, what if something goes wrong? Yes, like the unthinkable just happened. It's not wild to think something could happen when you're home. So the reframe that I do with a lot of these women about self-care and self-compassion and taking really good care of yourself when you're home is typically if mommy's good, baby's good. So it's really hard for women to buy into, you deserve this period because you're a human.
Sure.
But if we can also then say, okay, we're going to take really good care of you to model for baby, and making sure that they have the capacity to show up and care for a little angel 24. So it really is like the basic stuff. And then as time goes on, I find after 3 months, typically for most of my clients, something magical can happen. We figured some little things out after 3 months, like we're getting into the swing of things. That's when we really get like curious about, okay, so you're so much more than so-and-so's mom. This is now a huge piece of our identity. Do we miss gardening? How about picking up that paintbrush again? Or even if it's literally for 15 minutes, I think just nourishing that kind of creative energy if they have it, or a hobby outlet. But I would say for the first 3 months, it's like making sure your basic needs are taken care of.
Yeah. And then what about the parents that are in the NICU still for those extended times?
Oh, yes. 100%.
I just, that the self-compassion, self-care stuff that feels essential. So like, what are some strategies you would recommend?
This is a really important question. And I think other people have also thought of it, because I'll tell you. So do you know the Ronald McDonald House by chance?
Yeah.
Okay. Yeah. In Stony, in our local NICU, they have a Ronald McDonald House room. It's just for the parents to go from the NICU. There's snacks, there's shampoo. They have a really pretty shower that you can go and take a shower and cry your eyes out, and then try and come back and go be present for your baby. But for parents who are still in the NICU, you're forcing yourself at that point, because you're not going to want to eat. And it's pretty darn impossible to try and sleep when you're hypervigilant. And what if I miss something? And so many of my clients, God forbid, I go home and then I get that call. And so we do this with a lot of my clients, that like, if your best friend was going through this, if, your sister was going through this, if your brother, like, what would you tell them? So that self-compassion is all basic needs in the NICU. I can't think of anything more complex than that, because just surviving in the NICU is utilizing the resources that they have for you. And I would tell a lot of parents too, if you are not close with the social worker in the NICU, ask your doctors, ask your nurses, like, who's the social worker here? Because they have so many wonderful resources to connect you with. If you need a break, if you need someone to hug and cry, if you need a snack, like whatever it is.
I think that's such an important thing to remember, is most hospitals have a few social workers on staff. And if they haven't made it around, or you're like, the timings are off, right, ask your provider, ask one of the nurses, like, who's that social worker? Because you're right, they are going to have extra resources. Social workers are rock stars.
I'm proud to be among them.
So this is in the immediate, right? What about with the long term? How do you see birth trauma affecting parents in the long term? And do you have any tools or approaches to help them move through that?
Oh yeah. How long do you have? So I guess there's good and bad with this, like anything. The rate of PMADs, right, or like perinatal mood and anxiety disorders for mothers and fathers skyrocket if you've had a traumatic birth experience, right, for obvious reasons. The long term, when you are home from the NICU and you start your journey as a family or a larger family, and you're processing and you're grieving, really imperative to find a therapist who specializes in perinatal mood and anxiety disorder, somebody who specializes in working with NICU moms, or at least has that trauma background with that perinatal population. And if you need help finding someone, like, you can talk to your OBs, you can use this trauma directory that maybe we'll be able to link in the show notes. Just giving yourself permission to use the skill of asking for help and raising your hand, because I find the people who try and white knuckle it took me close to a year. I'm like ashamed to say this out loud. As a provider, can you imagine? It was almost a year where I was like, okay, I knew this was crazy, but I do need to talk to somebody. So finding that specialist, if you need that additional layer of support for psychiatric medication, if your hormones went wild and you need to follow up with your doctor, if you need to see a nutritionist, there's so much that happens to women and families like after birth. So we see that the rise in PMADS, anxiety, postpartum depression, postpartum OCD, really scary if you see postpartum psychosis. But the warning signs for that at least are so much clearer and you can get support sooner typically.
Absolutely.
And not just in your partnership either, if you are in a partnership, but in your friendships
and family systems.
I feel like our faces are saying it all, right? What do you mean? My in-laws don't understand this very clear, firm, loving boundary that we've set. And you remember this stuff. And we also try and give people the benefit of the doubt at the same time. It's really a tricky process. I'm biased as a therapist, but I would say like long term, like you deserve support and you deserve to get into therapy because it's totally understandable if you would be experiencing those symptoms long term.
Yeah. As we wrap up, what would you say are probably 2 or 3 of the most important just takeaways, in your opinion, around being a NICU parent or having birth trauma? What are those important nuggets for listeners to take away?
Oh my gosh, for the mamas and for anybody who's listening to this, who's experienced birth trauma or knows somebody who has, that there's so much bigger than their birth trauma, right? That like the way that their baby came into the world does not define them as like a mother, a person in any way, shape, or form. I also think you deserve a place to sit and work through and process the trauma that you experienced. It doesn't have anything to do with how much you love the stuffing out of your angel or what a capable, incredible mother you are. I actually feel wholeheartedly the opposite than the stereotype of, what an amazing parent you are. Like you're taking care of your mental health, you're taking care of you. What an amazing example of like health and wellness for your family. Just the biggest one that comes to mind, that there's a lot of help out there. So you're never alone and you don't have to go this alone. If you're like not sure where to start, I would be happy to get like any messages from anyone, point anyone in the right direction. And there's a lot of hope out there. Like finally, there's some movement here with birth trauma that's happening, that's gaining attention. OBs are starting to make like separate waiting rooms. You will be okay. And it's also okay to not feel just joy immediately after.
Yeah, absolutely.
Yeah.
Lauren, thank you so much for this conversation. This has been amazing. And I'm just so great with advancing the language around how we talk about NICU parents and birth trauma. I so appreciate you taking the time.
Thank you so much for having me.
So if people are interested in connecting with you, I know you're in private practice, you're on social media. What are the best ways for people to connect with you?
My gosh, yeah, we have it all. We're like on LinkedIn, we have a website, but probably the easiest way is I'm on Instagram at Sessions with Lauren. And so I have a link tree that you can go right to my contact me if you click the link in my bio. And typically we'll get back to people within 48 hours with whatever resource they need.
Amazing. Listeners, thank you so much for tuning in today. Remember to be kind to yourselves and take care. See you next time.
That's it for today's episode of Grief is the New Normal. If this conversation resonated with you or you think it might benefit someone else, please share it. Sharing can open doors to healing, understanding, and normalizing these griefy conversations. If you're craving deeper insights or ongoing support, consider signing up for the Grief Gap newsletter. It's packed with resources, tips, and personal stories to help you navigate your grief journey. Visit the website www.griefisthenewnormal.com to subscribe. For those who prefer a more personal touch to their healing process, check out my grief journal, Authentically Unapologetic. It's designed to help you explore your grief on your own terms, with prompts and exercises that encourage reflection and growth. I'm Dr. Heather Taylor, and I look forward to our next meaningful conversation. Our soothing tunes are provided by the Datacorns. If you're interested in sharing your story, collaborating, or learning more, please email me at hello@griefisthenewnormal.com. You can also stream the episodes on YouTube for more engaging content. Until next time, keep exploring your grief with intention and support, remembering you don't have to do this alone.